Welcome, future doctors, to another episode of the Future Minority Doctor Podcast with Dr. Sulma
and Marina, where we bring you conversations to empower and inspire you to contribute to your community and the world by becoming a doctor. Welcome, everyone, to another episode of the Future Minority Doctor Podcast. Thanks for listening today. I'm so excited to introduce our guest, Dr. Robert Texeira. And he is really cool. He is a hand and plastic surgeon at the University of Utah. And he also spends some time at a children's hospital and at a VA hospital in the same area. And this is the first time we've had on our podcast someone who does this particular specialty. So Dr. Texeira, thank you so much for being here. And we are excited to hear your story. So just kind of to start out with, tell us a little bit about your specialty and how you landed in that specialty.
Thank you so much for the kind introduction, Dr. Yeah, my specialty is one of the coolest things, in my opinion, at least. So I'm a trained plastic surgeon who specializes in hand surgery, but I do a little bit more than just focus on hands. So a lot of the work that I do is I take care of patients who have any sort of hand issue, whether it's numbness in the hand from carpal tunnel syndrome, tendinitis, which can be from trigger finger, arthritis. I do bone surgery in the hand and wrist too. I deal with tendon and ligament injuries. But part of my other side of the practice is I do things like if someone has really bad injuries to their nerves in their neck and they need some nerves rerouted in their hand that have weakness, I help deal with that. That's called brachial plexus injuries. I also deal with nerves in the lower legs too. Sometimes some of those nerves don't work really well, whether it's due to trauma or other issues. And the other part of plastic surgery that I do that's not exactly hand surgery is I do limb salvage. So if someone gets in a bad car accident, their elbow is ripped off and orthopedics helps put some of the bones together. I help cover over the soft tissue along with doing skin grafts and things like that, or treating the underlying nerves. I also do the same thing in legs too. I help the orthopedic surgeons with covering up a lot of those leg wounds and oftentimes help them make the decision between whether the wound can be salvaged, as in I do my big reconstruction, or if they need to amputate the leg or not. And I help make that decision with orthopedists.
Gotcha. That's so interesting. And that's cool to think that it's sort of this multidisciplinary team. I was rotating through trauma surgery. There was a vascular surgeon that would be called in sometimes, and then ortho, and then like you, plastic and reconstructive. So it's really cool to think about, even within the field of dealing with those sorts of wounds, there are lots of different specialties that get involved. So let's go back in time a little bit and tell us about your journey to medicine. When was the first time in your life that you thought, hey, I think I want to be a doctor?
So my mom is an endocrinologist, so a doctor deals with hormones at the University of Michigan. And she was a big influence. Apparently, as a little kid, I would run around as a little toddler and like pick up my mom's medical textbooks and read them or look at all the pictures. And so I always kind of had that exposure. I remember my mom getting called in the middle of the night or being on call, working long nights, and being young, going to like Christmas parties and things like that. My aunt's also a doctor. I am my mom's sister. She's a kidney doctor, or was one. Now she does mostly family medicine. Then having a different aspect than what I do right now, exposure and hearing them talk and watching them argue about what seemed like really boring stuff then, and close to it now, I can kind of understand, but I do a lot of the cutting, not as much of the medicine bit. When I kind of started thinking about medical school, maybe in high school a little, I thought the idea of being a doctor to save someone's life really fun and enticing to me. So I kind of went into college thinking that. And in college, I initially majored in biochemistry, and then I got taking all these other classes. Like I took this quantum mechanics class, and that actually threw a big wrench in the field for me because I found this love of physics that I didn't know I really had. And so it kind of like made me second guess myself and picking up a physics major while I was at it too.
Wow.
And
I didn't know that
yeah,
about
yeah, it was an interdisciplinary physics. So it was more biophysics-y than straight physics.
Mhm.
So, and then I was working in a biophysics lab in high school, or no, in college. And then I was like, well, I'm going to apply. I took the MCAT already. And I was like, okay, well, I'm not sure. Maybe I'll apply to a few medical schools. And if I get in, maybe that's what I'll do the next year. Otherwise, my lab PI told me he would grandfather me in to at
Uh-huh.
least get a master's in biophysics and go from there. And so I
Uh-huh.
applied to a few schools. I got in and I said, what? This is what I'm doing. So
hmm Yeah, fantastic. How were the college years for you? Obviously, you found that you loved something that you didn't maybe expect you loved. Was it navigating kind of the pre-med journey along with trying to create that interest as well?
it was difficult to navigate that. Yeah, I had my mom, I had my aunt. I was maybe not the most listening to my mother and aunt in terms of what exactly to do, in terms of
Yeah.
necessarily like heeding their advice, because I also wanted to pave my own path too. I think maybe one of my biggest regrets, I didn't have like a direct mentor who could like, a mentor who I listened to, who would
Yeah.
show me the path. And so college, it was good. I had a lot of time to explore the things that I really enjoyed doing. I loved music. I loved learning languages. I almost had a minor in both of those additional things. Physics later. Loved being at a big university to make new friends in all different fields. Um, and I finally kind of joined a lab with the help of one of my other friends. The medical school application process was, to be frank, a little disorganized for me because my writing wasn't the best. I only had my parents read my application essays. I was scared to show a few of my peers who would want to do it. To be in all reality, I didn't have many friends who were going into medical school just because
Mhm.
a lot of friends who I hung out with were either like other physics majors or like science like things or like social studies, music people. I didn't quite have as much that peer exposure that I wish I kind of had if I joined like a formal pre-med group or something like that.
Gotcha. Yeah, that's so interesting. And actually, I'm glad you bring that up because actually talked to a couple of friends who are physicians in the last couple of years and who have children now who are applying to medical school. And they talk about the challenges that they see the process was so different 20 plus years ago that I don't really know how to guide my child and they don't want to come to me for advice. So this is a dynamic that just kind of plays out. Even if you have parents who are physicians, you can feel lost, or parents who are PhDs, or parents who are academics, and feel lost partly because the process is just so rapidly changing and evolving over time and it's becoming more competitive in some ways and things like that. But also, I think it's just a feature of young adulthood that we really want to sort of exert our independence from our parents, and that's developmentally very normal. And so, even if we have adults in our life who could be great resources, we sometimes shy away, and sometimes it's out of fear, sometimes it's out of embarrassment, sometimes it's out of just naivete and other things. I remember for me, even if though I didn't have parents who were academics, it was very hard for me to ask for help. And I actually see this play out even more so among males compared to females, that there's this just pride that like I should be able to figure it out by myself. Did you feel any of that? Do you feel like that fed into it?
Some of us still feel that way today, right?
Yeah.
Yeah, it's just, I feel like oftentimes you want to try to do it yourself. You want to pave your own way. And you don't recognize when you're floundering and just, I don't want to say necessarily struggling, but like not achieving those goals and maybe just kind of wandering, being
Mhm.
lost and not having that guide. And there are definitely times that I wish I didn't even know I needed help. And that's the worst part. Close with my mom, but I didn't tell her everything, right? So
Yeah.
it's always that downside. And even now, going into my third year of practice at an academic center, doing really difficult cases, it's hard to ask for help. even
Uh-huh.
with some of my own like really complicated cases, things like that. But slowly over time, I've gotten better. And that's probably one of my like number one things I tell people. I tell my trainees, my residents, not all the time, that like, hey, like if you're not sure exactly what's going on, just call me. Just ask for help. Ask one of my
Mhm.
coworkers. And for any of the hard cases that we see in our clinics, things like that, my coworkers and I, we have a group chat. We send each other x-rays or interesting
Mhm.
pictures or dilemmas that we have and just bounce ideas off each other.
Yeah.
But it took me, I started residency in 2015. This is 10 years in the process. So
Yeah. And I appreciate what you just said too as well, that it's not like you suddenly get to finish your training and then go out into the world of being a seasoned doctor and attending and suddenly know everything. I think there's just so much to know in the field of medicine, and things are constantly evolving and new technologies are being developed, new procedures are being developed, new knowledge is being uncovered, that it's just impossible for anyone to know everything. And I feel that in my field as well, that there are definitely some patients that leave me a little bit stumped, and I have to talk to colleagues about it and I have to look up information to help myself. But yeah, this theme of asking for help and getting comfortable asking for help is something that I harp on a lot with my mentees, because the more you get comfortable doing it early on, the better off you'll be. And it's a habit that you're going to use throughout your career. So I'm glad you mentioned that.
it's like being comfortable with your insecurities and
Uh-huh.
comfortable with being vulnerable, I think.
Yeah.
And I think maybe it came with maturation now like a lot more open with my mom about whatever
Uh-huh.
things, open with things going on in my life, things that go on in my work life in terms of complications, interpersonal reactions, things like
Mhm.
that, and the people that I trust. And
Mhm.
even with terms of complications, a lot of that from a surgical perspective, it's hard because you did something surgically and they had a bad outcome, whether
Yeah.
it's something minor or severe. And it really takes a toll on the heart. But
Yeah.
being able to be vulnerable with your patients see that and they appreciate that.
Mhm.
Um, and so, and I just love being real with them that way. So,
Mhm. Yeah, that's great. That's great. A little bit about then your journey through medical school. How is it that you decided on this specialty for yourself? Because of course, during medical school, you rotate through all the different rotations and specialties, and by third year, most students kind of have to have an idea of what they want to do so that they can apply to the proper residency. Did you going into med school that this was something you wanted to do, or did you discover it, and how did you discover it?
yeah, I'm a hand surgeon now, but I hated hand anatomy as a medical student. It's absolutely ironic.
Interesting.
It was the first section in like the
Oh, wow.
first day of anatomy lab. We're dissecting these
Uh-huh,
hands. And I'm like, what are these muscles? I had a lot of medicine exposure growing up. Through
uh-huh,
my months, I shouted about them a few times, shouted some other their coworkers. I
uh-huh.
never ever thought surgery, but I
Yeah,
really
interesting.
liked. I thought I was going to go into ER. I wanted something exciting and fun and kind of hands on. And it really wasn't until medical school, my school was structured to the first 2 years. You were in classroom setting, taking exams. You weren't really seeing
Mhm.
as many patients up front. And the
Yeah.
start of your third year are all clinical rotations. So you're seeing
Mhm,
patients and doing whatever your service you're on is doing. So my
mhm.
first rotation was general surgery, and
Oh,
I
wow.
loved it. I loved being in the operating room, even though the hours sucked. It sucked being at work at like 5 a.m. and working until 5 p.m. or 6 p.m. or 7 p.m. I
Mhm.
love that. In a way, there are kind of these definitive outcomes, quote unquote, and
Yeah.
you can use your hands to help manipulate pathology to get them better. My first general surgery rotation was at a community hospital, and that's actually the first time I shadowed a plastic surgeon doing a mastectomy. And
Mhm.
the general surgeon was like, "Hey, do you want to stay and help the plastic surgeon with their part so you can see what they're
Yeah.
doing?" And I remember
Cool.
they helped mastectomy, cut out the breast cancer, and then we came in and we actually helped rearrange some of the tissue around to like reshape this lady's breast to give her like more or less a little mini breast lift from cut out all the cancer parts of the breast.
Yeah.
And I was like, I didn't know what just happened, but that was so cool.
Yeah.
So that was probably my first actual exposure. I did really like the head and neck anatomy portion from before, so I thought I was going to do ENT.
Oh,
So early on third year, I had this surgery exposure. Later on in third year, I did a rotation that was 2 weeks ENT, 2 weeks plastic surgery. I
uh-huh.
loved the crazy head and neck cancer cases where they cut out cancer going through and through the mouth, and they take a forearm, make it into lip, and then they take the fibula bone and make that into the mandible and resurface into oral lining. Super long cases. I did medical school at the Medical College of Wisconsin. It's in Milwaukee, and I was so scared to hang out with the plastic surgeon because I was like, I just want to do ENT. And I hung out with this plastic surgeon. He was the chief of plastics there. And we show up in his
Uh-huh.
office. And he's like, I'm Bob Havlik. You're Bob Texeira. How's it going? I'm also from
Uh-huh.
Michigan. You're from Michigan. Let's talk a little. And we had like the most laid back conversation. He showed me around clinic, and he had a really cool general plastics practice where he did a lot of cleft lip, cleft palate. We also did some hand, and then he also did some breast reconstruction. And the first week I hung out with him and had a lot of like face-to-face time with him and got to see the breadth of what we do. In plastic surgery, you operate from head to toe and all body parts. It's the skin and its contents.
Yeah.
And I hung out with some other plastics guys doing some hand, doing a lot of big breast reconstruction, doing big facial reconstruction. I love ENT. And then I realized, I was like, oh, this is what I'm doing. Like this, I get to reconstruct everything. And it's not as much like, it's not like doing in general surgery, they take out an appendix and there's like 1 of 3 ways they can do it. And you follow the steps, and maybe there's little variances in anatomy. Plastic surgery, in terms of reconstruction of the soft tissues and its contents, you follow generalized, it's more you follow a set of principles that help guide your reconstruction. So like
Interesting.
not every wound gets a skin graft, not every wound gets a flap. And you meet patients with what they have and what works for them. And that's what I love about it. That is what really enticed me to it. It was a lot more about the procedural aspect of it, but more of kind of the art of it, and more like the theory of it, which kind of coming from that physics perspective that like really spoke.
Yeah.
And then
That's really
and then I found hand, actually where form actually meets function. And
Yeah. Well, and people's hands are like really, really important. So I mean, it's really cool that you're able to specialize in particular in that, because I'm sure just that's a particularly complex part of the body and something that's so important to human functioning that we want to do whatever we can medically to preserve someone's hand function. Yeah. So speaking more about that, tell us what your kind of day to day now looks like. Does a typical day in your life now look like?
so in general, if the week is 5 days,
Yeah.
I normally am in clinic about 2 days. I'm normally in the OR for at least 1 day, if not 2. And then that last day is sometimes OR, sometimes it's a full day of clinic. It all kind of depends on the week. So, but a day depends on what I'm doing that day. So if I'm in clinic, for the most part, I start clinic at 8:30 or 9, and I try to get to the hospital maybe like a half hour, or on Fridays, I actually show up to the hospital a little bit earlier because I do a little resident teaching conference for them. And but nonetheless, we're talking 7 a.m. is generally about the earliest I got to the hospital in general.
Yeah.
And then if I'm in the operating room, depends on how many cases and how complex the cases am I doing. So average, I'm done by 5. If I'm in clinic, normally I'm done by 3 for me to wrap up notes. In the OR, I try to do my notes as I go, but sometimes I just end up procrastinating and doing them at the end of another clinic day. So most days, I would say 7-ish to 5-ish. Now, I do take call on top of that. When I take call, it's at least for a 24-hour block from 7 a.m. to 7 p.m., I take call either on Tuesdays or Thursdays, maybe 3 times a month. And if it's on call for a weekend, I'm on call from Friday morning until Monday morning at 7 a.m. So,
Gotcha.
and call is home call for me. So other than my clinic Friday or OR on Friday, I only go into the hospital if I have to do an emergency surgery on a patient.
Gotcha.
Help see a lot of the new consults or anything like that, say someone breaks their wrist and they can put a cast on it, and then I can see the patient in clinic the following week and actually book the surgery that way instead of taking the surgery right away. But if someone's hand gets cut off, I gotta deal with it. So
Yeah, gotcha. Yeah. Speaking of that, what's like an interesting thing that maybe most college-aged people don't know about hand injuries that you wish they knew? Or that's you.
hand injuries only take half a second to occur. So things that cause hand injuries. One, snowblowers. So living in Utah, especially in the winter, get stuck. And then inside of the snowblower, there's a spring. So if the snowblower gets stuck and someone puts their hand in it, the spring's still loaded, and that will cause a hand injury.
Ouch. I did not know that. Very useful to know.
Yeah. So always use a stick, or something to kind of stick in there to help unclog it.
Gotcha.
Also, another form of hand injury that living in the West that I didn't know before I moved out here was it comes from people at rodeos when they're like roping animals. Is that the ropes will get caught around their thumb oftentimes, and it'll rip off the thumb. And that's a set of patients I see.
Yeah, although I don't know. When I watch people using fireworks, I think maybe not, but yeah, those fireworks. Yeah, and it only takes, like you said, half a second for an injury to occur. And what are thinking about some of those like worse hand injuries? Are you usually able to salvage a lot, or are there some that you just really can't?
It often depends on 4 things I look at. Number 1, is there good blood flow? Number 2, what bones are broken? Number 3, are there good tendons? And number 4, is there good skin and soft tissues around it? So if all 4 are gone and there's no good blood flow targets for me to reconstruct, they tend to get an amputation. And that's actually tends to be a lot of my firework patients specifically.
Interesting.
Unfortunately, hand blows up. The other kind of severe form that we see oftentimes, especially in Utah, with a lot of people on ATVs or 4x4s or side-by-sides, injuries, in which they oftentimes get a combination of bony injury, soft tissue injury, tendon injury, and blood vessel injury. And those patients have really bad outcomes too. Sometimes I'm able to save some fingers, but not all. I'm in the midst of that part of my summer practice right now. So, and that's
ATV season, right? Yeah.
Yeah, it's rough out there. ATVs are another thing. If you roll over an ATV, stay on the inside of the bar. Don't put your hand out to try to brace it. ATV is always heavier.
Yeah. So knowing what and seeing what you've seen, do you ride ATVs, or would you ride an ATV?
I before as a kid, but I'm scared now. That's going forward. Thinking about kids, I don't know if I'd ever want them riding ATVs, seeing what I've seen.
Exactly. Right.
If it's an ATV, it better have a full bar, hands are in.
Gotcha.
And seatbelts on.
Absolutely. One of my first rotations was in trauma surgery, and it was like the 2 weeks when there was some sort of ATV like competition or some sort of like gathering nearby, and much trauma that I saw from ATV injuries. And since then, I just won't get in one. So, yeah, it's just good to know, because it's hard to unsee those things when we see them in medicine, right? And then we see the risk. Yeah.
And I do wrist fracture surgery a lot, and like too, and mountain biking is a high risk for that, but I'm okay with that because I don't do crazy mountain bike. I'm not doing big jumps and stuff. I'm mostly on the ground. But ATV, it's a lot higher energy than that. So
a lot heavier than just your body and the bike, right? Gotcha. All right. Well, tell us a little bit about like what are the things that you love about your job, and then what are some of the challenges of your job?
So I love an interesting problem that's presented to me.
Mm-hmm.
So that can either look like a complex limb salvage patient in which I'm trying to meet the patient with where they're at in terms of, okay, maybe we should cut off this finger and use the skin from the finger to move it over to help cover over everywhere else. Otherwise, I have to do this big other tissue transplant surgery, something like that.
Uh-huh.
I love seeing patients who are coming to me with like a stiff hand. Those are another subset of patients in which you're trying to figure out what was their previous trauma and what can you do to help augment their hand function.
Uh-huh.
I love patients with like these brachial plexus nerve injuries, in which sometimes we can actually have a really awesome result where 30 years ago, everyone was having horrible results.
Interesting.
Where we can do some nerve work in the arm to better reroute function, or we can transplant like one of the muscles in the thigh to make it into a new biceps that works. And that
Yeah.
is one of my favorite surgeries I've ever done.
Yeah. Cool.
I do a small subset of patients who have had really bad trauma to their jawbones, and
Mhm.
I've taken their leg bone and made it into the jawbone to help resurface that. And those
Wow.
are fun, rewarding surgeries. The most complex things tend to be the hard things, is long surgeries, long days. Like just a few weeks ago, I was doing one of these big jawbone reconstruction cases. It takes 12, 16 hours sometimes. And
Wow.
you take your breaks, you work workers on those long cases, but they are
Mhm.
really taxing. They kind of like the next day, I remember I had clinic the whole day and I just was struggling just
You're
because
tired.
you're
Yeah.
tired. Like it hurts still. Like you
Uh-huh.
get home, you're not hungry. Um,
Yeah. And it's a
and
long time to just focus, like all the cognitive energy that's going into it's like taking a 16-hour test. That's hard. You got to
yeah,
focus. You got to be really awake and aware.
yeah. Call sucks as a hand surgeon, not gonna lie. Um,
Uh-huh.
I some nights are fine, and a lot of nights I don't have to go in. My residency patients, they let me know what's
Mhm.
going on. But some days I already doing surgery on someone else who was already a planned surgery from like a few months ago and stuff like that. And then getting emergencies coming the door. I have to like do fasciotomies to free up all swelling in the muscles, or then I've got to like put someone's finger back on after that while trying
Yeah.
to fit it all in with other things. And when it gets really stressful is trying to figure out like, how do I properly triage some of these patients and like what can wait, what cannot wait.
Mhm.
Um, and that's something I've gotten better at. And the nice thing is working at universities that there's always help. And that's where it
Mhm.
comes, right? Like asking for help. So crazy deal like that a few months ago. And I asked one of my coworkers who was actually working with me, he's like, hey, can you like help finish off this one surgery? I need to go hop into this next one, get this
Yeah.
rolling, and I'll come back in to see where you're at and finish off over here and other stuff. And to be honest, I've helped my other coworkers out in the same way. And that's part of the reason why I love my job, is that I've got such awesome coworkers who we
Mhm.
all help each other out in a bind, who we hang out with after work too. So
Mhm.
um, I'm fortunate to have that support. And really, it makes me comfortable doing these really arduous call shifts, because I know worst comes to worst, if I got to put a hand or wrist back on, and I call one of
Uh-huh.
my coworkers and be like, hey, I'll come in, I'll help get some veins going. We'll start doing some microsurgery together. Like, it'll be
Mhm.
okay.
Yeah.
And I know that they've called me in and I've gone in and I've helped them with stuff too. So
Mhm.
it goes
Yeah.
both ways, which is what's so much fun about it.
Gotcha. For some of our listeners who maybe are not as familiar with like the timeline of becoming a certain type of specialist, like your type of specialty, tell us what of everything you had to do in order to specialize in what you specialize in.
So I went straight through from high school to where I'm at now. So
Uh-huh.
high school, 4 years, undergrad in 4 years also. So that's 8 years so far. And then medical school was 4 years,
Uh-huh.
12. And then I did an integrated plastic surgery residency, which means I start as an intern and I graduate as a plastic surgeon. That was 6 years.
Okay.
And then
6 long years, man.
6
Yeah.
long years. And then I was crazy and decided to do a hand fellowship after that. That was 1 extra year.
1 year. Okay. Well, at least it was only 1, but still.
Exactly.
1 on
So
top of 6. Yeah.
I graduated high school in 2007 and I finished fellowship in 2022.
Uh-huh. Yeah. It's a long time.
It's
Yeah.
a long time.
Long time. Yeah.
Yeah.
Really briefly so, I did my surgery rotation in medical school, really mixed feelings about the field of surgery. Really loved the work. I loved working with my hands. That some of the stuff you're talking about that you love about it, I loved too, the kind of problem solving, creativity, and like new challenges. But the culture I kind of struggled with, honestly. Like it was where I trained, it was a bit of a toxic culture. And I think
Mhm.
surgery as a field kind of has this very complex history that has fed into that. How is it that you navigated that? Did you find a really good program that had a different culture, that had really supportive mentors? Or were there times when you just kind of had to like suffer through a little bit and then get out the other end so that you could change that culture? Tell me a little bit about that.
Yeah. Surgical culture is a really nuanced topic. Just for the listeners out there, a lot of traditional surgical culture is a top-down approach from the higher ups or down to those lower than them. What my medical experience was like, oftentimes, it was pretty toxic in the general surgery realm of things.
Yeah.
The plastic surgeons who I worked with generally weren't as malignant that way, which also kind of helped draw me to that field. And because in general, a lot of plastic surgeons tend to be happier and tend to have a lot more job satisfaction than other surgical subspecialties.
Yeah. Interesting.
But that said, there still was that. There was still that underpinning behind it all. Part of it was recognizing it in medical school, knowing that like I would have to kind of put my head down and just work hard and try to earn these people's respect, which was, I guess, in a way, kind of demeaning to myself in a way, right? Like, why aren't they just respecting me out of right? Because, like,
Right. Yeah. In an
you know,
ideal world, that would happen.
in an
Yeah.
ideal world, right? And so I ended up matching at an institution that my plastic surgery residency, I did about a year and a half of straight general surgery.
Mm-hmm.
And it was rough.
Mm-hmm.
It was a pretty malignant program. I remember their program director yelling at me and singling us out for being plastic surgeons at plastic surgery residents in a general surgery conference. And and it sucked. It hurt. And the only thing I could say to myself to help keep me through is that, like, hey, I'm never going to be like this to my trainees and my peers and my coworkers and the future of students and surgeons. Like, that's not how it should be. And B, like, something's going on with this guy, like, outside of work. And it clearly was. Like, some of the other co-residents, my co-general surgery co-residents they felt the same way. They're like, this culture is toxic. And it actually did come to a breaking point in their residency program later on, which had a big change in their leadership. And it got to be a lot more of some of the issues they were having. This was kind of right before the start of COVID, a year before that in 2019. But still, there's like, what makes surgery hard is that the minimum number of surgeries that are determined by whatever body certifies your residency program. And in the States, we condense them all into like 5 or 6 year blocks. And the only way to get those numbers is to like be there all the time. And so you're there for really long hours. Like in my plastic surgery residency, I would show up at like 5 or 5:30, depending on how busy we were. And sometimes we'd operate until midnight and I'd be back the next day at the same time.
Yeah.
it was hard. There's no question about it. Or if you were on call, like, I remember one of the longest surgeries I ever did was like 20 hours, and I had to do surgery all the next day. And
wow,
that was brutal.
That's rough.
Yeah. And the other part of it too is that there aren't enough people. There's not enough manpower to do all the work too sometimes. So there's not enough either PAs or other mid-levels or residents to cover all the cases to help make their service run efficiently or smoothly. And that all that extra stress of being there all the time, I think also fed into a lot of that toxic culture of surgery programs. Because surgery programs have evolved a lot. And since when they were first founded in like the late 1800s, where they were called residents because they would like stay in the hospital.
Yeah, they lived there.
They lived there, and they had this model like you were with one surgeon the whole time and learned how they did their thing. You didn't have big formalized residency programs until later, and they still took up after that. And we're still trying to shed that and recognize people's lives now.
Yeah.
And I'm fortunate in and of that, like I graduated from my residency program, having had my experiences, a community residency program, a lot smaller, but it was super busy, to a large academic medical center, Washington University in St. Louis.
Yeah.
And they were super busy too, but the culture was a lot more positive in a way that like they supported their residents, gave their residents time to play, and not play like in the OR necessarily, but also like give them autonomy, but also give them their personal time. And it felt a lot more respected. And seeing that, it felt so invigorating to go back into that academic to see that. And like, it was much different than where I went to medical school. And I was like, oh, this is awesome. And then I found an awesome job in which everyone who I met, I loved immediately. I was like, you're going to be a good friend of mine for sure. And the residents were so supportive of each other here. And we support the residents. The residents here they have a pretty decent quality of life for being super busy and still at work too.
That's great.
And so, and I try to recognize fatigue in the OR and try to recognize when I'm doing my long cases, we try to do it with multiple team members. And I try to support an environment in the OR that like, a junior thinks something isn't going right. I tell them I want them to speak their mind. Like, it's okay to be, I want them to understand it's okay to be wrong, and it's okay to say the right thing too. Because saying the right thing is actually the most important thing.
Yeah, definitely.
And so I try to cultivate that. I don't want to call it necessarily horizontal, but like more openness in the way I do things.
Wonderful. And I'm really hopeful that I know it's already changing. I see it changing as I talk to pre-meds and trainees and things. But I think people like you, it takes people who go through that system and say, hey, there's something wrong with this. I want to be part of the change. And it does take developing a bit of a tough exterior in order to be able to survive going through that. But if able to somehow kind of protect your core self and your core values during that process of training and come out the other end and be the change, I think that's really amazing. So thank you for doing what you did to get through that training and now being part of that change for future generations of surgeons. One last question. So if you had one last piece of advice for young people who are considering a career in medicine, what would that be?
Can I say a couple? I think one that we said before is don't be afraid to ask for advice or help. And going on that is ask for help. Ask your mentors. Reach out to, when you're applying to medical school, this is the first time most people are doing it, or if they're doing it again, that's fine too. But you need to have multiple eyes on your application to be successful, I think. I think in terms of especially personal statements or things like that, having a couple of different sets of eyes helps you gain the perspective of someone already in the field.
Absolutely.
Also help in terms of if you're in trouble in school or something like that, ask for help with classes or find peers that you can trust that aren't going to belittle you. It goes a long way. And the final thing is believe in yourself. I'm lucky that I had my mom to help me along this journey. And I did suffer from imposter syndrome, which is a whole other thing we can always talk about, right?
Yeah.
But I think believing in yourself, being real with yourself, and making a plan to succeed, that's how you succeed. So.
Yeah, couldn't agree more. All of those. Thank you so much, Dr. Teixeira, for being here, for sharing your story, for sharing all of your pearls of wisdom and insights about your particular field, the field of surgery, and how cool it is to be a hand plastic surgeon. I learned a lot of stuff that I didn't know, and I'd love to. Oh man, I missed that. I wish I could go shadow you or something. That'd be cool.
Thanks for having me, and you're always welcome to come hang out. I'm always like to show some of the interesting cases. So
awesome. All right. Well, thanks everyone for listening. We hope you learned a little bit from Dr. Teixeira. Have a wonderful day until next time.